Um, so I'll just, I'm sure as Tiago said, I'm now working in a company called Science for Change. And our motto is Science for Change for City Empowerment. Now I can't change this. Oh, okay, yes. So as Tiago already presented me, I won't go into detail, but mainly I just wanted to to share that my main background has been biomedical sciences. I've worked for more than 50 years as a researcher. Now I continue to do research, but applied to the science communication fields. So it is possible to change careers sometime in your life if that is your main goal. And also, as I briefly mentioned to you last week, I had the opportunity to develop various science communication projects that were either to focus on gender and also a diversity of voices from young researchers to senior researchers, involve them in the process of communicating your own results to society. And this was mainly working with different kind of media, with television, radio, also new media, and involving journalists. And I think all of this added up into the position that I'm currently now. And I think you will be able to see the connection of everything that I've been building up into what I'm doing now. So in Science for Change, we are interested in tackling worldwide challenges that can be either related to social, environmental, health, or technological challenges. We are focused on evidence-based solutions, so science is within our core. We are interested in increasing trust in science. We want to make it inclusive to everyone. And we are also connected to other values as responsible research, open science, transparency, and in the end, to have a more democratic society. So another thing that I know that Tiago likes a lot is that we want to move from top-down approaches to bottom-up innovations. And for that, we need behavioral change to achieve those goals. So our main aim within the company is to develop user-centered, innovative services and products based on citizen science, participatory strategies, community engagement, and co-creation processes to facilitate social innovation. So last week when I mentioned citizen science, someone asked, so exactly what is citizen science? So I included it here because it is important to focus exactly where the scope where we are working. And so citizen science is a term coined in 1989. It had evolved the concept through the years, but mainly it relates to the citizens that participate in scientific research, covering a wide range of topics that can include all areas of science and through multiple practices. And this can be done within 3 levels. The first one is contributory. So citizens normally act as data collectors. It can be collaborative. And a part of doing data collection, citizens can participate in refining the project design, in analyzing data, and also disseminating the findings. Or we can move to what is called a more extreme citizen science approach, where citizens work together with scientists and other stakeholders that I will also mention a little bit further. And usually are involved in most, if not all, the phases of research process. This means that this is a horizontal process where everyone contributes in a co-creation environment. And if you would like to see this specifically on the context of health, you can also find another term that is called patient and public involvement. So this would be what you would see as citizen science, but our citizens have particular specificities. This means that they have a medical condition. So they have a disease, and that's why you can find it in other terms, depending on if you are looking into literature. Maybe you won't find it within a citizen science context, but it will be the equivalent. And if you can see here on this pyramid, we would have a little bit the same structure as I mentioned before. So now we are moving towards a participative approach where people are just subjects in a clinical study, towards engagement, where sometimes you can have, for example, an open day at the university or the hospital, and you invite people to come. And this is normally a unidirection communication. And we would move to an involvement, which means that the patients are involved in setting research priorities and steering the direction of research. So we would be also humanizing science. And in this context, you can also find normally the concept of patient experts. There is an academy within Europe called EUPATI, and what they are doing is that they're training people, patients, but also can be carers, that can have a specific training and help, for example, in evaluating projects, in participating specifically in involvement actions within the projects in order to advance also in this agenda. No? So coming back to our company, if we could resume what we do, we involve citizens in science to improve society. We have a standardized methodology that involves different phases. Mostly we use also techniques of design thinking and participatory research. We have the different methodologies that we use are both inclusive, adaptive, and replicable. We also are very careful in trying to include the standard development goals, the sustainable development goals, I'm sorry, and also the Rio Declaration of Leave No One Behind. And all of this should always have in mind to include all the principles of responsible research and innovation. And using all of this, we hope to have and help create new data sets that would lead to social innovations that can respond to different challenges and also improved policies. So our approach is related to what is called a quadruple helix stakeholders engagement model. You are probably in an early stage of your career, but when you start writing proposals, this is something that will come up in the near future. This is very related to what it's called the innovation model. And the idea is, in order to have a specific solution or innovation, you involve, in this case, 4 types of stakeholders. So you have the contribution of the policymakers, that can be local governments, public institutions, and other types of authorities. On the other side, you have the civil society, citizens, associations, they can be NGOs, activists. You bring together also the industries, and obviously very important is to have the academia present. There is also now another new model that has come up that involves a 5 element, that is the climate action. Okay, this is something that we already consider in some of the projects that we use, but for the moment we are focusing on this type of engagement model. So I bring you here one of the projects that we are working on as a case study of citizen science. And it is the one that will be related to one of the challenges that you have, and is specifically related to odor pollution. So basically, our company was born in order to give response to one of the main environmental challenges that we have, that it's odor pollution. If you don't know that, you probably don't. It is the second cause of complaints of related to nuisance worldwide, just after the noise. It is something that there are a lot of deficient regulations in the different countries. Also, there is a lot of difference between also the different regulations within each country. And the current methodologies consider specifically the environmental impact, but not the impact specifically on people. So in this sense, we created an app called Odor Collect. And what is the main idea of this app is that the best sensor that exists to understand the impact that the odor noises can have, it's our noses. So at this with this in mind, what we want to do is activate and empower people that are mainly affected by this problem, and help them to act on this. So we want them to be active contributors into the solution. So within an European project called the Noses, we have created 10 different pilots around the world, but mostly in Europe, in Chile, and also in Uganda. And what we did in these cases was involving different stakeholders from the 4 groups that I mentioned to you before, and in the different cities. Specifically, this was done within a city's area. So depending on the country, different stakeholders could be involved. So this was studied and specifically adapted to each of the contexts. So this process involved different phases. So we wanted to raise awareness first on this issue. Then each of the pilots involved creating communities. Also, for example, we went either to libraries or we went to local markets, and on that we would try to create groups of citizens and train them in how to perceive different odors. So we also train them on the app that lets you to do that. And one of the strategies that we used was within these training sessions, we included sensory walls. What does this mean? Is that we went to specific places where we knew that we could be exposed to different kinds of odors in order that people could report them on the app. And then we had another phase which involved as not only the mapping but also the validation and analysis of the data. So another important feature of this project was the creation of a website called Odor Observatory. So in this case, we not only have the mapping that you can see also in the website of the app itself. But in this case, we can involve also the stories of the people. So everyone can participate, and they can experience they can share their experiences. They can also map, for example, they can include news on the newspaper. They can include stories from blogs that they have found, pictures. So in one sense, this allows to create a community, but at the same time, try to map within time how a different problem can evolve. And you, for example, in terms of newspaper, you can even try to find a problem that occurred on that specific community 10 years ago. No, so it's important also to have this temporal mark in order to understand how the problem evolves and affects communities. And one of the biggest results, or where we really want to have impact, is already on the stage of, or on the level of policies. So one of the results of this project was the green paper on odor pollution, which is a policy document that aims to place odor pollution in the policy agendas by providing recommendations to tackle this issue and move towards an improved regulatory framework in Europe. And the project is just closing, and we end up tomorrow with an event in the European Parliament in order to present this green paper. Another project that was born also as a response to the diagnosis was that when implementing the project, the partners realized how important it was to have a good science communication strategy. Of course, now that we are working in a complex and multidimensional environment, we have different formats and channels of communication, multiple languages, multiple cultures, and many other factors. No, so, and one of the things that is really important is to have to reach out the citizens, to reach out different stakeholders and have them engaged in your project, because it's important for them. No? So in this sense, we created another project called Nucera. It's called Citizen Science as the New Paradigm for Science Communication. And what we want to demonstrate is that citizen science is an inclusive, broad, and powerful communication mechanism that will allow for, in one side, increased trust in science communication, and in turn in science at large, which now makes even more sense concerning considering the infodemia moment that we live in, also the impact of the fake news. It also contributes to other principles of the responsible research innovation that I mentioned before, that it's opening up science and innovation to society, raising awareness and literacy in science, and finally reducing the chances of incurring in fake news by promoting critical thinking. And we do this not only by including the 4 stakeholders that we mentioned, but considering this complexity in communication currently, we also include data and science journalists. And so what we're doing at the moment is that we are following 39 citizen science projects in Europe, and we involve them as pilots in what we call citizen science communication labs, where we are co-designing communication strategies with them. We will then test them and validate them within 3 years. And at the moment, we have organized 5 labs. We have more than 250 participants. And we are now in the second, are going to enter the second phase, which will be refining the strategies that we have co-designed in the beginning with them through evaluation, either of both digital and non-digital formats. In the end, the idea is that we have a series of blueprints that will serve to be disseminated to the entire community. And we want first to disseminate or the challenges that have been found throughout the project, but also the main takeaway ideas so that we can inspire other citizen science projects to overcome these challenges that are common and also increase their impact by applying whatever they feel it's appropriate for them. So I don't want to take more time with you. If you have any other questions, we can talk a little bit more after. So thank you for your attention. And this is the Science for Change team. As you can see, it's a dream come true for me because we are the majority of women. We have a CEO that is a woman. So we are on the lower 20% of startup companies in Spain, but we will try. So here are our contacts and anything we can just talk a little bit more now.